Hi everyone, this is part 2 of the Locum Provider Nextgen training. Today we're going to have a large focus on workflow. So I am going to log into Nextgen and show you what it will look like whenever your front office staff checks the patient in, your medical assistant or nurse brings the patient back, and then you complete your visit. So let's log into the EHR. Okay, because I already have my preferences set, my location came up as a default location and my name came up as the default provider, or this would be the provider that you're working under. I also have my inbox pop up automatically because of my preferences. So if you don't remember how to get that to happen, you can go to Tools and Preferences and refer to training video number 1 or ask during your live training. So what we're going to do is really focus on workflow today. So what is really going to happen in a live environment? You'll see here that I can review my appointment list for the day. I can see that I have this patient coming in for an annual physical exam, a sick visit, and an immunization visit. So I'm going to check one of these patients in and show you really what it will look like. So this step is not something that you're responsible for. It's something that your front office staff is going to do whenever the patient arrives. So take note that the statuses all say booked because the patients haven't gotten to the office yet. But now let's pretend that the second patient arrived. So your front office staff will go into the practice management system, and that's where I am now, and right-click on the patient's name and check them in. I selected the option that says check-in create encounter because that will go through the check-in process and it will also create an encounter in EPM and EHR that will correspond with each other. In the first training video, I was speaking about how the procedure codes can flow over from the EHR back into the practice management system. That happens whenever the encounters are created and connected during the check-in process. So your front office staff knows what to do. They will go through and select all the options. And let's just press the OK button. This patient had 2 appointments for today. Okay, so front office staff will go through the autoflow process. They'll ask the patient about demographic information to see if anything has changed, different statuses and other fields that are required for the practice to go through and review with the patient during the check-in process. They will check their insurance, and the visit or the check-in process will actually be complete. It may take a few moments because some things need to process. Okay, but I'm not going to actually print anything now, so I'm just going to close out of that. But your front office staff would complete the autoflow check-in process. So I'm now going to go into the EHR, and I'm going to also refresh this so that we can see how it changed. Okay, so now this is either your view or your medical assistant's view, and they will see that this appointment status now says kept. So that is their cue to go up to the front and get the patient. Now you may have noticed that I clicked on this icon right here and pressed refresh. You can always do that. Or down in your preferences, you can have it refresh every so often. If everyone has it refreshing every 1 minute, it could put a strain on your system, so you may not want to have it refresh that frequently, but I would recommend setting something here so that you don't always have to refresh it yourself to see if something has changed. So let's then press the OK button. So I am now playing as your medical assistant or nurse. So I would go up to the front and get the patient and bring them back. and I will double click on the encounter or the visit. You will now see that I have the patient open because I can see their name here in this blue title bar. I can also see that I have an appointment here for the day, the 10/4/17 at 8:15 a.m., and I'll complete the 4-point check. So this should always happen before any documentation begins on the patient, and the 4-point check is making sure you have the correct patient's name, correct location, correct rendering provider, and encounter date and time. So I can see that these match up so I can start to document. The nurse or medical assistant will go down to the templates button and select the intake button or the intake option. If you don't see anything here, if it's blank, you could go to all and find the intake template that way. Let's go back to preferred though. We set these also in our preferences in tools and preferences. So let's select intake. And we can begin documenting now. So the medical assistant or nurse will select the specialty. So we'll select family practice, and the visit type will be office visit. They will then proceed asking the patient questions. So for example, I'm going to say that this patient is here today, and it did say cold symptoms. So I could go to additional manage and find more in here. So let's see if we have something that says either cold symptoms or cough. Yeah, cold symptoms sounds good. So I can single click on that. And maybe the patient also has a cough, so I'll select that too. The nurse or medical assistant does have the option to ask the patient some simple questions related to their reason for visit. It's up to the practice and your relationship with your medical assistant or nurse if they should be doing anything more than just selecting the reason for visit. I'm going to select something just so that you can see what it looks like if they do. So I'm going to say that they will address their cold symptoms. And the status is maybe it is getting gradually worse. And I'll fill in the onset too. Maybe their cold symptoms started 1 week ago. And they had a sick family member. And they also have a cough that is dry, and it is aggravated by cold air and exercise. And we'll just leave it at that and press save and close. Okay, so now it puts it into a sentence format. Onset 1 week ago. Patient describes the cough is dry. Problem has become gradually worse. There is a sick family member. Symptoms are aggravated by cold air and exercise. They could also go to the intake screen or the intake comments button and type in additional information here. These comments here are only for the nurse. So I'm just going to type in that patient has a trip coming up and wanted to make sure they are healthy before they leave. So you can still see these comments, but they're things that won't be edited by the provider. This can be edited by the provider, but this should stay just as things that the patient told the nurse. So let's go down and look at our vital signs. So they can then put vital signs in. So we'll press the add button, and I'll put in that this patient is 5'6" and their weight is 140 pounds. Okay, so that's within normal range. Maybe they have a 99.7 temperature and their blood pressure is 130/83. Okay, so they're generally healthy. Maybe their pulse may be a little bit elevated. Okay, and save and close. If anything was significantly or out of normal range, we would have an alert that would pop up. Okay, scrolling down, I can see that this patient is on lisinopril. So at this time, your nurse or medical assistant could do a medication reconciliation. So I'll quickly go through that just to show you what it is in case you ever need to do something like this. We will say that a manual medication reconciliation has been completed. Maybe it was completed because the patient, I'm just going to type in patient here. And we could also type in patient here. Or self. Okay. We'll minimize this screen. And we would then ask the patient, are you taking your lisinopril 5 milligrams every day? So I put a check mark and it says taking as directed. If it was anything except that, I could change it. But we will say that they are taking it as directed, and I'll click on it, and then it moves down to the medication adherence. They are taking it as directed. And then I can save and close. So the medications have been reconciled. Moving down a little bit further on the screen, it says no known allergies. That's fine. I will then select reviewed no changes just because I checked with the patient if they still don't have any allergies. And because this patient does have cold symptoms, I'm going to check them to see if they have strep throat. So I will go to standing orders and find the rapid strep. For this interpretation, I'm going to say that it was positive. And then press the place order button. My screen resolution is a little off, so I'm not seeing a close button. Let me see if I can minimize this. There we go. And save and close. Okay, let's then look at review of systems and say that your nurse is probably not doing anything else. They are finished with their part of the visit. Then they will generate their intake note. So the intake note is going to summarize everything that the nurse did. Sorry, it's taking a moment to display. So here we go. The intake note is a summary, as I mentioned. Everything that we documented will pull into here. So patient described the cough is dry, patient has a trip coming up. This was their problem list from before, also their problem list from before or past medical surgical histories. Their family history, which we did not enter, but because this patient is an established patient, those are pulling into the note for you to review. Labs completed, rapid strep was positive, and their medication. Okay, at this time, I'm going to close out of this screen. I'm also going to scroll up and find my patient tracking and change the status here to ready. And maybe I could indicate what room they're in too. Maybe they're in exam room 1. And save and close. Okay, so this was your nurse's part of the visit. Now we're pretending to be you, and this is what we really need to focus on today, but it is going to make a lot more sense now that you're seeing what your nurse or medical assistant did before you're going to get the patient. So the status now says ready. That means that you are ready, they are ready for you to see them. They're ready to be seen by the provider. If you're seeing that the status is not getting updated, you could always have a conversation with your nurse or medical assistant and ask them to make sure they're updating the status. You may not even need to update the status, though. If you guys are passing each other in the hallway frequently, they could simply tell you this patient is ready, or you may have another system for knowing whenever it's your time to see the patient. But this is just a way that you could see it in Nextgen that you might find helpful. So let's double click and go into this patient's record, and now we are pretending to be the provider. Okay, so we double clicked on the patient's chart and we logged in. Now, we don't see anything up yet because we haven't clicked on anything. But we can go over to our history toolbar, and if for some reason you don't see this here, you can just click on the history button at the top of the screen and it will appear. And let's go to our intake note. We would then review what our nurse did with this patient to then have a better idea of what we want to do. So knowing that the patient had a positive strep test would be great to know before we're going in and seeing them. I know that's in a perfect world and the test may not have actually been completed at that time, but if it is, then I went into my intake screen by clicking on the right-hand side, and we can then go into the SOAP note. The SOAP note is where the doctor does most of their documentation. So I clicked on SOAP, and then I can make changes to this. So I can see what the nurse documented previously, but I can go in and gather some more detail. Maybe we could say that the frequency is that it is persistent, and that also maybe T makes it feel a little bit better. And we could do a basic review of systems at this time too. So let's say that the patient does have a cough, because we are aware of that, and that they do not have a fever, so indicate that that's negative, and that they are positive for a sore throat. And then we can save and close. So I added a little bit more detail to the reason for visit. We could also go into cough, and if we wanted to add anything here, we could. So as far as the cough symptoms go, we could just do free texting in the HPI field. But we address some of the cough symptoms or some of the cough in the cold symptoms area, and that's okay. Now that we know that the patient has a sore throat, we could also go into the additional /manage and find sore throat in this list and address it in more detail too. If you already addressed it in the cold symptoms though, that's probably fine, but just to show you more of what you can do, I'm going to find it here. Okay, so here's sore throat, and then I can click on that. And now I have a quick visit that popped up. So you may have noticed that a lot of the HPIs have corresponding pop-ups that go along with the problem. So it does make it pretty helpful. You won't get that with everyone, as you saw with the cough, but you'll get them with a lot of them. So for the sore throat, let's say that it is pretty severe and that there is no change with my sore throat that the patient has. And yep, there was a sick family member. And if there's anything else that we want to document, we can. Throat lozenges and humidifiers help. And then we'll press save and close, or OK. Okay, there we go. So let's scroll down. And the next area on my screen is the review of systems. So because I already addressed some review of systems in my HPI, they carried into this. I'm going to go to the one-page ROS and just do a general overview of the review of systems. You can be very specific if you want to focus on a problem. It's totally up to you on how you want to do it. But I'll ask the patient a couple questions related to just how they're feeling. Maybe they do have fatigue. They haven't had any night sweats. They do not have any ear pain or eye discharge or eye pain. They do have nasal drainage and sinus pressure. No shortness of breath or wheezing. No chest pain, no abdominal pain. No constipation, no diarrhea, no nausea, no vomiting, no dizziness, no headache, no back pain, and save and close. So I did a fairly detailed review of systems, and let's scroll down. So at this time, I can review the vital signs, and if there was anything additional that I wanted to take, I could press the add and I could enter in another blood pressure, I could retake the patient's temperature, I could do anything that I wanted to do at this time. There's also a link for the health promotion plan. If the patient is obese or does need some dietary or physical exercise counseling, that can be addressed in the health promotion plan. Let's scroll down a little more and look at our physical exam. So I'm going to select the one-page exam. I can indicate that things are normal. So overall, the patient's normal. And if I am addressing it, I can either select it as normal or I can put the details into this field, either if it's normal or abnormal. So for example, overall, I said the patient's normal, but maybe I could say that they're age appropriate instead of just saying that they are normal. Sometimes different providers like to document different levels of detail, so it's up to you on what you're more comfortable with. I am going to say that I examine their eyes and they are looking normal. And their ears are also looking normal. Maybe their tonsils, though, are looking erythematous. Sorry, they're maybe a little bit swollen. So let's indicate some other things are normal that we checked. Respiratory is normal. Cardiovascular is normal. So whatever you're checking, if you're not checking it, then don't worry about it. And then press your save and close whenever you're finished documenting. You could also go in and do a more problem-focused physical exam. So you could go into, for example, respiratory, and then it would take you into things that are just related to the respiratory system. You could also go into, for example, nose, mouth, and throat, and get things that are more specific to that as well. So we'll save and close. Now moving down, we're on our last section, which is the assessment and plan. So the patient had a rapid strep today, and the diagnosis code automatically got put in there because it was a standing order. So encounter for screening for other bacterial diseases. But it was confirmed that this patient had a positive result. So let's go into our assessments. And we'll put the diagnosis in. So this is a list of everything that the patient has been diagnosed with previously. These are their clinical problem lists, so things that you're tracking. And this one is not anything that's necessarily been on the patient's record before. It's your common diagnosis codes. So I'm going to do a diagnosis code lookup and search for strep throat. Okay, that looks good to me. So I'll double click on it and then press the add/update button. Okay, so here it is. And now I can do some things. So I can write out a plan for the patient. I maybe want to order some medications. So I think I'm going to do those two things at this time. So if I go into the A/P details, I can choose my streptococcal sore throat and go into this grid on the bottom left. So the grid on the bottom left is your patient plan details. There are other grids that you can type in. For example, these are impression comments. This is a differential diagnosis comment, and this one is for the provider. So this grid on the bottom right will not print on your master document. Or actually, I believe it won't print on the patient plan. It's a little bit hard for me to see, but I think that this isn't going to print on the patient plan, so the patient won't see it. It is still an official part of their record, though, so don't put anything in there that you wouldn't want anybody to see potentially. But these are comments that the patient typically won't see unless they're seeing a full copy of their medical record. So to type in comments that you would like the patient to see, we could go to the plan, patient plan. So bottom left screen, let's type in drink lots of fluids, medications as prescribed, and rest. Okay, something like that. Follow up if okay, so I have my comments in here for the patient to see, and then I'm going to go to the Save and Close button. So we have those here, and then the next step that I'm going to do is I'm actually going to put in a medication for this patient. So if I go down to the bottom right, I will see my RX. And I will prescribe new. And let's say that we're going to give them amoxicillin. And I apologize if this doesn't make much sense. But we'll say amoxicillin 250 milligrams, select. Take 1 capsule by oral route every 8 hours. Again, just to be Joint Commission compliant, I'm going to say by mouth every 8 hours. And quantity, let's give them 60 and accept. Okay. Then I would press the send button. And that's okay. This is their eligibility data. This is checking to see if this medication is on their formulary. And here is their pharmacy. And then I would press the send button. Okay, we'll cancel and close out of the med module. And then let's continue on to our E&M coding. That's at the very bottom of the screen. It says E&M coding. If you happen to be at the top of the screen, it's the next tab that says finalize. So you can go to it either way. Okay, so I have my diagnosis codes in. Let's scroll down and take a look at our medical decision-making level. So this is the evaluation management coding, E&M coding. I'm going to say that this was a low complex visit and then calculate the code. I did a pretty significant amount of documentation, so it's pulling every check mark and every radio button and field that I filled in on the templates and trying to figure out how much I did and what type of code to give me. The patient is an established patient, so it will be in this column. And yep, we can see that it gave me a 99213. If you received a code that you think is lower than what you should have gotten, you can scroll down a little bit on your screen and review what happened. So if you like to do a lot of free typing and you didn't choose a lot of checkboxes and radio buttons for, your HPI, your review of systems, your physical exam, then you may get a lower code even if you addressed it because you free typed. In that case, you could always manually overwrite the code by choosing it here, but it is a good idea to choose the code that Nextgen recommends unless you did a ton of free typing and it's just not able to capture that. So let's then press the Submit Code button. So I have a Z code as my primary diagnosis. Let me show you what that means. Okay, my chart node is automatically generating. So sorry about that, because I do want to make a change. Okay, now my master document is generating. The master document is the one that we'll sign, but we're not quite finished yet. I want to show you if this happens to you in real life, what you're going to do to fix it. So going back to your finalized screen, the reason why I got that error message is because the screening code for the strep was listed higher than my actual diagnosis of strep throat. So all I have to do is at the top of the finalized screen, go to sort, and then I will click on the strep. Then I will click on the encounter for bacterial diseases and save and close. And then it will flip them. So now if I go to submit my code, it shouldn't do that. So I actually have to go through calculate. I'm just going to select the 99213 and submit. Okay, I didn't want to regenerate my documents because I didn't make any changes. Okay, so we have our chart note, which is a summary of what we did, and it can be customized in the background, but I'm going to close out of that because the actual document that we review and we sign is called the Master IM. So let's review that at this time. Scroll down and make sure everything sounds great. So the HPI, history of present illness, their cold symptoms, their cough, their sore throat, the intake comments, that's what the nurse put in. Their problem list is displaying, their medications that were reconciled. Allergies, review of systems, vital signs, physical exam, completed results, and the assessment and plan, and also any medications that were added today. So if this looks good to me and I'm finished, I will press the blue check mark, and what that means is that I'm signing it. So that is signing the document and indicating that you're finished with it. So I'll press the blue check mark, and then what happens is the signature will go on it. So electronically signed by me at this time. If at this time you weren't finished with your documentation, you could always go back into your templates and regenerate this master document once you were finished. You can always sign the note by pressing the blue check mark, or you can go into the PAQ. If you forgot to sign it, that's a place where this will be sitting and waiting for you if you forgot to sign it at the end of your visit. You won't have to remember to go in and look through your whole patient list. If you go to your PAQ, it will be waiting there for you. So I'm going to close out of my Master IM, and I'm going to close out of my Finalized, and yes, I will save changes, and then I'll go to File, Close Patient, and if I wanted to, I could even change the status. You can do that by going to Edit, or you could do it in the patient's record like I did before. And this can get updated automatically from EPM, but if it doesn't, you could type in, you could do something like that just for your own self. Okay, so that was going through a basic sick visit. What we're going to go through next is a telephone call. So what if a patient calls in and they aren't feeling well, or their medication is making them not feel quite right? I'm going to show you how you would document on a telephone call template. Now the workflow is always going to be a little bit different depending on why the patient's calling in, who's the first person that took the call, the back and forth that's going between the, potentially the front office staff, the medical assistant, the provider, the back and forth. So it is always going to be a little different. So I'm just going to show you a very basic flow that may happen. So I'll click on the patient button to search for a patient, because typically whenever a patient's calling in, that doesn't mean that they have an appointment for the day. So we're not going to look for them in our inbox. So I'm going to search for someone with the last name Test and select this Test patient. So I can see over here a history of all the times the patient was seen. Last time they were seen was on 8/8/2017 and the provider that they saw. But now I'm going to pretend that I am taking a call. So we want to do our 4-point check still. So Livingston, provider, who the patient is, and the encounter date and time, which this is incorrect. This is the only thing that we're going to say is incorrect at this time, so we'll press the new button. So I press the new and now everything matches up. Then we could go over to our telephone icon where it says telephone call, or you could go down to your templates button and select telephone communications. So we still have to select our specialty and our visit type. So for specialty, let's select family practice, and the visit type of patient communication will automatically populate. So the next step is to look down here at these blue links. So depending on why the patient called in, you may select different things. So if they called in for medication management, maybe they wanted a medication to be refilled, you could select the medication link. If they had a medical question, you could go down to the medical question link, test result request, referral request, forms and record request, billing question, other, an outgoing call, or something that's related to charges. So for this example, we're just going to go to the medical question. So starting off at the top and working your way down, we'll say that the contact type was an incoming call. So the patient called us. And let's say that we spoke with the patient self, and then we could talk about their concerns. So maybe the patient has been having, let's do something with medications. So this could be your medical assistant or your front office patient or person taking the patient's call. So at this time, they could fill in more if they wanted to, but I would say that they would probably send you a task. So to send you a task, they would go to the Send and Close button, and then they would find your name. So I'm going to try to find someone in here. Okay, so we're just going to pretend that we send a task to the doctor. So this is just playing, and we can't actually replicate exactly what's happening, but we send a task to the provider, and the provider will then address this. So the provider would see a task in their inbox, and I'm sorry I closed out of it. I'm going to actually try to get that in there again so you can see what it looks like, even though it's not actually going to be a sent task. So I'm just going to do this and select yes. Okay, So in my inbox, I can see that there is now a task. And this was sent to me. I can actually review who sent it to me if I double click on it. In real life, there would be a button that says accept, because then you were receiving a task, so you could accept it, and then go to the patient's chart. So you could click on the chart button and it would take you into the patient's chart. So communication says the meds are making the patient feel dizzy. Hopefully your front office staff would have indicated what medication it is. So maybe it is the Tylenol, probably not. So we may need to call this patient and get more information on them. But let's say that we want to reduce the dosage, or we want the patient to come in for an appointment. Depending on what we want to do, we could select different actions. So on the right-hand side, you can select different things that you'd want the patient to do, or you could always type in a comment here. But I will say schedule an appointment, and I'm going to say immediately. And then I could reply and close to send it to the person who initially sent me the task, or I can send and close to send it to somebody totally different. For example, someone at the front office or my MA if they were not involved in the call before. So let's just say reply and close. And I think we're pretty much finished with this. So I'm going to generate a document by pressing the preview document button. The preview document button is a good idea to do on all encounters, and the reason for that is because documents can be printed or faxed. So if somebody requested a patient's medical record, if you didn't generate a document to go along with this, they would not see it unless they actually had rights to come into your EHR to view it. So the front office staff or medical assistant would get the task to schedule an appointment for the patient, and then this one would be done. So at this time, it's completed, and you could go to File, Close Patient, and in your inbox, make sure that you put a check mark next to it to indicate that it has been completed. And maybe we don't want to see completed tasks, so then they can go away. If you have any more questions with this, you can practice it during your live training. So a few other things that we're going to go through now are not just general office visits. We're going to look at just some different functionalities that the EHR has that you will be addressing during an office visit, but maybe not the exact flow that we went through before. So let's search for a patient and just select somebody. And because we're in tests, I am just going to press new because I'm showing you just different template functionalities now. Okay, so I showed you what the nurses do during an intake, and I showed you what you will generally do during a SOAP note, but there are different things that you should be aware of that the medical record has. So let's go to histories. So the histories template will show you basically what it's saying. It will show you all of their chronic problems, past medical surgical histories, interim histories, previous diagnostic studies, smoking and tobacco usage, and things like that. So you may not be addressing those things all the time during a standard sick visit, but if you're doing a initial visit with a patient or an annual exam, then you will probably get into some more detail. Also, if you're addressing their chronic problems. So looking here under the Histories tab, I'm going to actually condense these just so that you can see everything that we have here. Problem list, medical surgical, diagnostics, family, social. So let's look at the problem first. So this is the patient's tracked problems. It's not just a history of everything they've been diagnosed with. It's things that you could actively be monitoring or chronic problems. So we could add new chronic problems. And if we press this add button, it's going to take us into the problem module, which was covered during the first training, part 1. So the hypothyroidism, if we are addressing this at this time, we could go to the view/add notes. And I can see that the last time that I addressed this was on 9/21, and I have an endocrine follow-up and a thyroidectomy for a benign module. I could add another note here, and I'm sorry, mine are very simple, but I'm going to say medication is improving condition, and then I could maybe even type in specific labs that are related to this. Okay, whatever they are, and press the OK button, and then close. So now I'm just addressing these chronic problems that the patient has. I could move on to the next one and continue to move down. I'm going to close out of this and move on to the next area. The next area is the medical surgical interim history. So we have that this patient's past medical surgical interim history was that they had a pregnancy. We could put something else in here. I'll show you that just by pressing the add button. And maybe in the past they had cancer. Okay, so let's indicate that and select what type they had. Let's see, colon cancer, and the management of that disease was, let me see if I can find some sort of surgery in here, and if I can't, then I can find it somewhere else. Maybe radiation therapy. Okay, save and close. And let's collapse this panel and open up the next one. The next one, previous diagnostic studies. So maybe you didn't order a test, but another provider did, or the test was done before the patient came to see you. Again, that's probably the same kind of thing, that it was ordered by another provider. So that could be put into here. So let's press the add button. And I will say that this patient had a mammogram, and this was ordered elsewhere. And it was a mammogram screening, bilateral. And if we have a copy of it, we could say see scanned reports. If we know around when it was completed, we could also document that too. And add to grid. Because this is connected with coding, if you are using your care guidelines to manage your health maintenance, it will update it. Okay, so collapsing the panels again, and let's look at the family history. So we'll press the add button in family history. And let's select that we just generally maybe typically ask if there is a family history of certain things. And we'll say this patient replied with no. So is there a family history of coronary artery disease? Is there a family history of hypertension? Is there a family history of diabetes? And it's making us select a specific kind. So let's do type 2. And save to grid. But let's say that maybe there was a family history. Their mother did have cancer also. And what type of cancer did the mother have? Cervical. The onset was 62. And save and close. Sorry, I'm not sure why the grids keep toggling open, but here we can see it, that the mother had cervical cancer at 62. We'll then collapse that panel and let's look at social. So for social histories, I'm going to just show you some general things that are in here. We won't fill out everything, but a common one that is addressed is the tobacco usage. So let's say that the patient did use tobacco at some point in their life, and they were a former smoker of cigarettes, and they did use them daily, and it was maybe about a half a pack a day. Oops, I'm sorry, that's half a cigarette. We'll say half pack. And the years used, 5 years, and they started when they were 15 and stopped when they were 20. Okay, so we have that in there. And then there should be a button here so we can save and close. There's other things in there as well. As far as passive tobacco exposure, smoke exposure, things like that. They also have caffeine use. So this patient typically drinks 2 beers a week. You can click through and see what they've answered previously. So if they tell you one thing one time and then something else another time, you will then be able to see it here. Let's move into soap now. We already looked at the soap tab before whenever we went through our office visit, but there are a few things that I didn't mention that I think it would be good if you were aware of. So let's move down and look at the review of systems section. And I'm going to open up the one-page ROS. So anytime you see these icons that have the circle with the save disk, that's an indicator to you that you can create a favorites list. So you could, if you typically during an annual exam ask almost everything, you could create, say the things are all negative and then save it and then access it. Maybe during a cold visit, you have your 10 things that you ask your patient. They're typically either positive or negative, and you could indicate which one it is, and then you could mark those or save that as a default, and then they could be populated every time a patient comes in with a cold. So I'm just going to show you what that looks like. I'm just going to do a couple things here, and you would definitely just want to do whatever makes sense to you. I'm just basically showing you how it works. And this one is for female, so I'm going to want to remember that. So I'll then press my save disk. I'm going to call this female cold symptoms. And then I might put my initials after that. And save and close. Then just to show you how it works, I'm going to clear it out. You wouldn't actually have to do that, but to show you how it works in this training environment, I will then go to the circle, and then here's all of them. This is the one I just created. So I can double click on that, and now here they are. And then I can make any changes. So if some things are positive, I can indicate that they're positive and save and close. Okay, so that's showing you defaults. You can do that on review of systems. You can also do that on the physical exam. You can do it in many, many places, and it's just where you see the blue circle with the save disk. Let's now look down at our assessment and plan. So in the first video, or not the first video, but the example of the workflow that I went through with you, I simply just typed a plan for the patient. I didn't go through how to order any diagnostic studies or a referral or things like that. So I'm going to show you how to do those things now. So we need to have a diagnosis, and this isn't going to make clinical sense, but I am just going to click on a diagnosis code so that I can get to different things. And I have my acute cystitis without hematuria, and then I'm going to go back to the AP details. So I'm in the AP details, and what I really want to show you here is my phrases. So if you are commonly typing the same things over and over again to your patient, so in that first example, I went through a cold recommendations for my patient. So drink lots of fluid, plenty of rest, follow up in a week if symptoms are not improving, things like that. So if you find yourself typing the same kinds of things frequently, you can create something called a my phrase so that it can just be typed once and then brought into anybody's record. So let's go down to manage my phrases. And there's actually already one here that looks pretty good, but I'm going to create another one. Plan patient, that's the one that you'll want to select for the grid or the screen or the field on the bottom left. And then the my phrase type. Maybe I'll be very specific. And press your add button and save and close. So we're pretending that this is our cold symptoms, and then we would select the My Phrases button and find it here. I can make any changes if I want to. I can type more. I can do whatever I want, but it will just bring in canned phrases that I created. Okay, we're going to move on now to the diagnostics. So these are diagnostic studies that you can order. So you would select your diagnosis code, and then depending on what you want to order, what type of test, you could click on it. If it's maybe an X-ray, an MRI, an ultrasound, a CT, GI study, we'll just select the first one and select, an X-ray exam of the spine, for example, and then press the place order button. When you press the place order button, you'll want to task the referrals department. So let me try to see if I have that list in here. Here we go, LCH referrals, add users, and okay. So this is now notifying your referrals department that you want this patient to have an X-ray exam of the lower spine. They would receive that notification in their inbox and then be able to proceed with getting that scheduled. Let's now look at the referrals tab. So who are we referring this patient to? Maybe we want to refer them to cardiology, and who is the provider that we want to send them to. You can click in there, and if you drag this down, it may look like it only goes to C. However, if you just click anywhere and type in a letter, it will take you down to that provider's last name. So we'll select this provider and then go to why we are referring them to this provider, consultation, reason, and then any additional comments that you want to add. Press the add button, send a notification to your referrals department, and then you can save and close. Okay, we will then move on to the office. These are office procedures, things that you are doing in the office. These are very simple procedures. I'm going to show you something that's more detailed in a little bit. So office services, let's go to maybe we're giving medication in the office, or any one of these that you see. Just these are very simple things that you're giving a patient that you want to have documentation that it was done. So for this one, let's say that maybe we gave them some sort of medication. So we have like a depot injection, or we may have a vitamin B12 injection. So things like that. So we can select that here, And then we could go through and document if we were the one to give it, put in the expiration date, lot number, manufacturer, or our medical assistant, if they were giving it, they could fill those fields out too after we place the order. So we have this selected and we will press place order. Oh, please reselect. Let's try it out again. But maybe this person is our medical assistant. We'll just pretend an okay, and then that should be fine. I'm going to try to do it one more time. I'm not sure why it didn't work. Vitamin B12, place order. Not sure why that's not working. Maybe because we're in a test environment, but test it out in prod if this is something that you're doing, and if it doesn't work, then we can update that. So let's save and close. So speaking of office procedures, things that are done in the office, there is also the procedures area at the very bottom of your SOAP page. So let's click on that, and then I'll show you exactly what is in here. So these are a little bit more in-depth procedures that you're doing in the office that require more documentation. More documentation than just a strep test, more documentation than just you gave a depot injection or a vitamin B12 shot. These things require a little bit more. So let's go to the IUD, for example. And you'll see that there is a lot more here than just what we looked at in the other screen. It talks about consent. So let's say that consent was obtained, questions were answered, risks were explained, correct patient identified, correct site confirmed, and the IUD, maybe we removed it with no complications, okay? Or if it wasn't that, we could go to written consent was obtained by patient, okay? Okay, and then submit to Superbill and save and close. Okay, so that's how you put in a procedure. There are some other things in here too. So for example, there's the adult immunizations. That's at the top of your SOAP screen. They may have you begin to do this a different way. But for now, this is how it's done, and it does function very similarly, but you may learn that soon you're putting them into the module directly. So to put in an order for a vaccine, you simply just put a check mark next to it, choose the one that you're giving, indicate the sequence, and place the order. My patient has a latex allergy, so if I wanted to still give this, I would press yes or no to abort. I'm going to say yes. And then I could task my medical assistant to actually give the vaccine. They would then come in and indicate that it has been done and fill out information like the lot number and the dosage and things like that. Okay, I will close out of the immunization template now and say yes to saving. And there is a lot more that you're going to learn. But for now, those are really just the very basics of Nextgen. So we went through how to document a visit from start to finish. We looked at a telephone call template. We looked at some additional features that the EHR templates have. So if you have any questions, you will be having a live training. And during that training, anything that you have questions on that came up with during this video, that can be asked at that time. So hopefully you feel like you have a little bit of a better understanding of Nextgen. Thanks.